I was first influenced since third grade. I had this passion for psychology after viewing the movie The Miracle Worker with Helen Keller. And from that point forward, I was intrigued as to what went on in people's minds and their feelings and thoughts. And then I didn't realize I fell in love with an ROTC military student at my undergrad, and I didn't realize the life journey it was going to take us on, being in all different parts, nationally, internationally in the world. And so my environments in which I practiced psychology were very diverse, from outpatient clinics to hospital settings, academic settings, federal government, and just now private practice in all different countries and states. So we've had quite a journey which diversified my psychology practice. The work with disaster mental health, I'd have to attribute this starting back when I was younger. I was influenced by my father. He always had the Maryknoll Mission magazine at our home. And, they taught us to assist those who were in need and acts of service. And then I took a lot of Red Cross classes growing up. And then from there, I went on, and with my husband's career, we were in Germany, a Desert Storm. And I became very involved with the CISM J. Mitchell training, critical incident debriefings, and assistant in debriefing active duty members after Desert Storm. And then from there it just grew. I became Red Cross certified disaster mental health with Red Cross and FEMA, and then became involved when we lived in Hawaii with natural disasters. After coming back to the mainland, I got involved with Katrina, assisting after the hurricane there. And then I was involved with Virginia Tech tragedy, responding nationally to Virginia Tech, and then went on and got involved with more international work, like with the earthquake in 2010 with Haiti. I've been practicing 30 years, so over the decades I've seen the growth and development of psychology, the field that we're in. And I trained on the DSM-2, and now it's DSM-5. But having had world travel and being a military family, it was amazing how CalSouthern's internet accessibility and flexibility came to be. And they're affordable. And we were also at that life stage where I was no longer obligated by my children's family obligations, so I was very available to pursue this. I've never lost my passion for psychology. I love it, and just wanted to I wanted to reach the highest terminal degree that I can and have that recognition and be specialized in my field. So the Doctoral Psychology program through CalSouthern was the program. It was ideal for me. My doctoral project was creating opportunity after crisis, examining the post-earthquake Haitian mental health care system, and the lack of mental health care in low-income countries. World Health Organization predicts that by 2030, depression will be the leading global disability, worldwide. And so that the low-income countries, over 85% of individuals don't have treatment for mental health. And as we know, that impacts countries, societies, as well as individuals, both socially and economically. Currently, I have a private practice, a small practice in Slippery Rock, and working with young adults and couples. And I hope to spend continued time with my family and 5 grandchildren, as well as I want to pursue my international disaster mental health work, particularly, for example, like with from Haiti to Nepal. Though it's a different culture and smaller, a lot of the emerging themes apply in terms of setting up sustainable mental health programs in low-income countries. And I'm hopeful that my research raises awareness, advocates for those who are oppressed, and gives a voice to marginalized individuals who are suffering from mental illness while we call for global mental health change. I had first deployed to Haiti as a disaster mental health volunteer, and I was inspired by their resilience and the spirit of the Haitian people, and I saw them suffer and were challenged as they overcame their challenges from the 2010 earthquake. And then I came back and enrolled in the program, and I realized that was the heart of my project, are the Haitian people. I realized that the research I was going to do would involve a global mental health system and to help those less fortunate. My experience in Haiti inspired me, and then I'm hopeful that the research then moves forward and creates that awareness and helps those who are marginalized and to call for the global mental health change. The sustainable programs involve integrating with primary health care systems, using evidence-based practices, but most importantly, using the practicing the cultural values and morals of the country that you're in. And with that, they're hoping that we could have sustainable programs and develop programs that were either non-existent or were less developed. So integrating into the primary health care systems, being culturally sensitive, using evidence-based practices are key and can be applied to any third world country.